Hey, thanks, Dr. Jones, for coming on and spending the next 20 minutes with us. I know you're very busy. I know Mark showed you a 2-minute video that taught you about a great program that can really help your patients and also that Medicare is covering, and it could be a nice profit center for your pharmacy. So, what I'm going to do today is just spend 15 minutes to really show you the details of the program. Then you can ask all the questions you want, and we'll answer them, and we'll see if this is a right fit for you and your pharmacy. Is that okay? Great. Well, again, my name is George Veronis. I'm actually the Vice President of Sales and Marketing for Remote Care Today. And I also have a good friend and partner of mine, Brett Rice, who's been a real community pharmacy advocate for over 20 years. And I showed him this program, and he recommended, because we were only taking this to the doctors at the time, that I bring this to community pharmacies, and it would make a big impact for them and really be a good program that they should look at. So, Breck, I let you introduce yourself, and I know you're going to say a few words about it, and then I'll get into the details of the presentation. So, over to you, Breck.
Thank you, George. And hi, Dr. Jones. I'm so excited for you to hear more about this. And like George said, I've been helping community pharmacies now for 2 decades and love the industry. Will do everything I can to help. I'm the co-founder of ServeRx and also a pharmacy podcaster. So I do the PBM Reform podcast on the Pharmacy Podcast Network. And then I also have the More Profit Roundtable, where I have been preaching for the last 2 years for community pharmacies to expand their scope of services into clinical services. So when George approached me with this remote therapeutic monitoring opportunity, I got super excited, and I think you will too. You know, when we talk about remote care, everyone's familiar with CCM or chronic care management and remote patient monitoring or remote physiological monitoring. But the RTM program, remote therapeutic monitoring, is fairly new. It's only been around for the last 2 or 3 years. And it is the easiest for pharmacies to get set up. So when you evaluate what CCM and RPM, it requires their primary care provider to be involved. So there's some extra steps that are involved with that, setting up those two programs. But remote therapeutic monitoring, Remote Care Today has a completely turnkey solution for your pharmacy to get involved and start helping patients in a way you've never been able to help them before. I love what this is going to do for your senior population. And George is going to go into some of the statistics of how it's going to help your patients. But I love that there's no capital investment for your pharmacy. You can get started with this and make pure profit for your pharmacy. So you're in the right place and excited for you to hear this today. Thanks, George.
Well, thanks, Breck, and thanks all your recommendations. And I know we've done a lot of pharmacies together. It's been a lot of fun. So let me just educate you for a minute on RTM because it only started a couple of years ago with CMS. But what's neat about it, almost every one of your seniors will qualify for the program. You know, if they have any medical conditions that have anything to do with muscles, bones, tendons, ligaments, nerves, they're all medication management, respiratory issues. What senior doesn't have some kind of pain, stiffness, weakness, swelling, numbness, lack of balance? And of course, what's neat about it, the improved outcomes of the program is better cognitive issues, mobility, motion, balance, reducing falls, and pain relief. And what's interesting about that, the two most common things that seniors think about and worried about every single day is falling or cognitive issues. And the reason CMS was so excited really about helping cover this is because number one, in falling, it's the leading cause of injuries and death to seniors. They spend over $50 billion. In fact, I think the average fall costs them about $30,000. They project that it's going to go over $101 billion in the next 5 years. Obviously, cognitive issues are a big deal, dementia, loss of muscle balance. And again, there's seniors falling every single day. Other concerns are by the age of 70, 2/3 of all seniors experience cognitive decline. Every minute someone's diagnosed with Alzheimer's, you have dementia being that could be delayed, believe it or not, by 5 to 8 years if you have a structured program like what you're going to see here. And of course, there's loss of savings and quality of life when seniors aren't doing something about this. So I'm going to show you a couple videos that really details this for you to really explain how our program, and I think this 4-minute video really does a great job in explaining everything that we do. So listen closely, and then afterwards I'll summarize it We'll do one or two other short videos, and then you can ask us all the questions you want. So let's listen.
America's independent pharmacies, 18,000 strong, are a pillar of thousands of our nation's communities. But it's no secret that many today are under financial stress and need to find new sources of revenue within their existing businesses. That's why we're happy to introduce you to our Brain Health Plus program that can provide tremendous benefits to your patients and significant new revenue and new profits for your business. Brain Health Plus, a remote therapeutic monitoring program, RTM, is backed by overwhelming scientific evidence, is covered by Medicare Part B and most Medicare Advantage plans, and can help prevent, treat, and often reverse musculoskeletal disorders, memory loss, cognitive regression, and loss of balance, thereby slowing decline while helping prevent falls and loss of independence. It can even reduce the risk of dementia by as much as 75%. Brain Health Plus, accessed on a smartphone, tablet, or computer, is the most robust, enjoyable, and engaging RTM platform available for your patients and can help them achieve amazing results, as they'll look forward to the daily activities which are fun, engaging, diverse, and provide great feedback on improvements, all designed to improve balance, cognition, and respiratory functions. These exercises and games are so effective because they stimulate the brain, improving memory and balance. Rather than the same old day-after-day exercises some programs provide, Brain Health Plus has numerous exercises, games, and activities so patients never get bored. We also send a daily engaging email message encouraging patients to check out the quote of the day, fun history facts, and encouraging healthcare facts that motivate patients to be engaged in their own health. Our built-in medication management module includes daily reminders and potential drug-to-drug interactions. Your patient's smartphone also scans labels of both prescriptions and OTC products and feeds them right into the system, also providing out-of-date alerts. The platform also features geofencing alerts, where family members can be notified automatically when a loved one is at a hospital or ER, without requiring patient interaction. If admission was required, when it's time to go home, discharge papers can be photographed and integrated right into the system. And having this data readily available has resulted in a 50% reduction in 30-day hospital readmits. We also include engaging diagnoses and specific health education for patients to help keep them as healthy as possible. In addition to our Brain Health Plus platform, we also provide a revolutionary solution for patient engagement, an easy-to-use AI-powered 30-second biometric facial scan, which they can use at home with a smartphone or even a computer's built-in camera. Your patients can use it as often as they wish to track their health, help identify risks, and stay engaged in the Brain Health Plus program. With 96% accuracy and 98% repeatability, it can analyze metrics like heart rate, blood pressure, oxygen levels, health risks, and others. This is not a substitute for medical care, but it is an accurate way to identify symptoms that just might help your patient recognize the need for lifestyle changes or make healthier choices with diet and exercise. You can make Brain Health Plus available to your patients because we make it so easy, as we provide a turnkey solution, without ever any cost to you. We take care of all Medicare billing under our platform provider's Medicare NPI. We also take care of all patient support, coaching, and encouragement. Introducing Brain Health Plus to your patients is also easy. We'll provide a landing page containing a video that shows them how much fun and how helpful the program can be, as well as educational and user testimonial videos. Then give them an opportunity to enroll right there. We'll also reach out by phone to assist with the enrollment process. Our turnkey Brain Health Plus program can have a major positive impact on your patients and your pharmacy's bottom line. Let's work together to get your pharmacy on board and your patients enrolled.
So that's a good summary of our entire program. And, there's a lot of different engaging programs within this platform that they could do, different exercises that have to do with balance, also with the brain and cognitive issues. So they could do a variety of whatever they need. We do assessments for them. We obviously every month reassess them to see where they're doing and what they're improving on. And we're looking to improve all the areas, as you see, with cognitive balance, falls, pain relief, etc. And a nice thing about it is covered again by Medicare Part B and Advantage plans. So what I'd like to show, this will be just 2 minutes, to actually see one of the programs that the seniors are on, because the big part of this program is, can we engage them and keep them on throughout month after month after month, because they have to engage in it about 16 times per month. And that's what our goal is on this platform. So our company, Remote Care Today, Fit, is powered by Ludofit, one of the programs. We have 3 or 4 different ones, as I mentioned. So here's an example one, and you'll see why seniors love it and why they stay on it.
Exercise is a critical intervention, but seniors often struggle to maintain a routine. That's where Ludofit comes in. Ludofit turns exercise into an engaging and interactive experience. Seniors explore virtual destinations, from skiing in the Italian Alps to cycling the Tour de France, all while performing therapeutic exercises that improve balance, strength, coordination, and brain health. Ludofit is accessible for individuals with a range of mobility needs. It runs on any laptop or iPad and uses the webcam to track movements in real time. The program continuously adapts exercises based on each individual's needs and performance. All outcomes data is securely stored, giving users and their care providers meaningful insights to track progress over time. Ludofit isn't just fun, it's clinically proven, harnessing years of clinical development behind its sister product, Gentronics, a virtual rehab system used in over 500 centers and backed by 8 published clinical studies. The app has wide applicability across healthcare settings, from senior communities to home health to independent use at home. Ludofit is a solution that is as flexible as the needs of older adults. Scalable, clinically backed, and easy to use, Ludofit empowers individuals to stay active while supporting organizations in delivering better care.
You can see, Dr. Jones, how powerful that program is. So the other thing is that we want to take all the heavy lifting off of you from the marketing side. So we do all the patient engagement and we do all the marketing for you, and we actually pay for it. So we'll provide you with posters, bag stuffers, cards, handouts, everything that's co-branded with your name, your logo, QR codes, links, landing pages, all to the pharmacy. And then we provide you all the content. One of the neat things too is we have a scanning device. It's called Scan Your Face, Track Your Health. And if you have a texting system, we send out to your patient base, it'll come from you. We'll actually create a video for you that you can do that's real simple. It'll say, "Hi, I'm Dr. Jones. I evaluate this great program that take care of the 2 biggest issues that seniors have, from worrying about falling and cognitive issues. Watch this video below, and if you're interested, you can enroll in this great program that we highly recommend." So that's coming from you. It's going out to text. They do that. Then we get the patient. We put them through the insurance provider process. They qualify, which almost everybody does. Then we engage and we take over for you. So you have no involvement in that except for maybe recommending it and putting a good word out when you see your patients. So there's nobody else that has such a robust system, this unique platform, many programs, many games, facial scanning. And with our engagement that we just talked about, we'll have a 70% enrollment for the people that we reach versus most programs that have less than 30%. So it's going to be highly successful. And at the end of the day, you're going to do a great service for your patients. And of course, you're going to make some nice profits. So the question always is what do we have to do? You don't have to have an MPI number. You don't have to be involved in Medicare. We have our MPI number. We do the Medicare. You simply are doing an admin service for us that takes about a minute per patient. And I'll show you exactly what it requires.
Working with our program is easy for you and your staff. If you choose to review your patient's monthly progress and earn administrative services fees, you will be sent a weekly email notification reminding you to log into your portal and review patient assessments. You or an appropriate member of your staff will review these reports, review the summary data for the patient, add your notes, and then simply click the sign-off box next to the record. It's that easy, and it's that fast.
Like Breck loves to say, is that if you have 100 patients on this, you're making $2,500 a month. It might take a staff member or yourself less than 2 hours to do this, which is about $1,200 an hour. So again, the more patients we put on it, obviously, the more profit you'll make. But again, there's no additional staff. There's no cost to you. There's no admin fee. It's strictly doing an assessment, helping your patients. Actually, one pharmacy that we signed up that has about 110 locations actually said to us at the end, wow, what a great service that we could take to our patients and at the same time help our community pharmacies, with more revenue and profit that we really need. So this is how simple it is. This is the next step. I'll just end it with this, and then we could open up for some questions.
To get started, your next steps are easy. First, complete our agreement and sign the BAA, which ensures HIPAA compliance, and then we'll schedule your onboarding meeting. During this meeting, we'll show you what we mean by a turnkey solution. We'll discuss how we engage patients and the materials we can print and provide you that help patients engage with us. We will then educate and onboard your patients using approved text messages, emails, and friendly phone calls, providing the patient the appropriate programs and coaching, all without any cost to you. And don't forget, you can earn monthly administrative service fees by reviewing your patient's progress. It's about better care for your patients, more profit for your pharmacy, all with a zero out-of-pocket investment. Let's get started.
So at the end of the day, for the pharmacist like yourself, you're going to improve patient care, additional profits at $25 per patient per month. So it is a residual. That's about $2,500 per 100 patients, completely turnkey, and again, no capital investment. I know, Breck, I think that together we probably talked to a total of a couple hundred pharmacies already, and I think every single one of them decided to move forward. And why don't you just give your final take? We'll wrap it up, and then Dr. Jones will open up for any other questions you may have.
Yeah, thank you, Dr. Jones, for taking the time to hear about the remote therapeutic monitoring program from Remote Care Today. And as the next steps here, your care consultant can send out the paperwork for you that covers the business associate agreement. And then you'll want to have an office champion. So whoever is going to take the lead for you at your pharmacy, can be you, or maybe it's someone that you're going to assign to do this. And, one of the most successful pharmacy outreaches that I've seen is when they take a two-prong approach to this. So not only does Remote Care Today provide the marketing materials for you at the pharmacy level to engage with your patients, but they'll also do a lot of the heavy lifting for you, but through your communication systems. So two-prong approach is you doing outreach, and then Remote Care Today doing outreach. And again, they'll do that through your communication system. So does your pharmacy software have the SMS refill reminder for text messaging? Because that's one of the tools that they would use. And then they also can use what is called phone mirroring, where if they make outbound phone calls to the patients, it's from your phone number. It's your caller ID on there too. So we leave that up to the individual pharmacies, what their comfort level is, but you will be HIPAA protected. And that is the most successful way, is that two-prong approach. So it's pretty easy to identify which patients to onboard. Just run a bin analysis out of your pharmacy system. Identify all of your Medicare Part B patients will be all of the Medicare Part D patients in that system. So it's pretty easy to identify that. And then we look forward to having you on board. The platform goes live later this month, and so the sooner that you get in the queue for your onboarding call, the better. Because, like George says, we have presented this to a couple of hundred pharmacies that are all waiting to get started now. Thanks, George.
Really, really appreciate it. Thank you, Brett, for coming on, being such an advocate for the community pharmacies. We're having a lot of fun with this program, Doc, and we love working with everybody, and really excited to help the community pharmacies like yourselves really expand their business and help all their patients. So appreciate your time.